Welcome to the Explainer. You know, there's a question that millions of people ask themselves every single day when they look in the mirror, and today we're going to get to the bottom of it. So, have you ever looked in the mirror and just wondered, why is my face always red? If so, you are definitely not alone. And the answer might just be a really common, but often misunderstood skin condition. Okay, so in the next few minutes, we're going to explore what rosacea is, why it happens, and, most importantly, how you can manage it. We're basing all of this on a clinical guide for medical pros, so let's dive in and demystify the science behind that redness.
All right, first up, that persistent facial redness. What is this common condition? To really get a feel for what we're talking about, let's start with what a typical experience looks like.
Yeah, take a look at this. This case history, it just perfectly captures that frustrating, years-long journey so many people go through before they finally get some answers about what's happening with their skin.
So here's the deal. Rosacea isn't just a temporary blush. The crucial thing to get is that it's a chronic inflammatory condition. That means it has periods where it gets better and then periods where it flares right back up, and it usually starts showing up somewhere between the ages of 30 and 50. And you might be surprised at just how common this is. We're talking about a global prevalence of over 5%. That's a huge number of people dealing with this every day.
Now, this is pretty interesting. While we see it diagnosed more often in women, the data shows that men who have it are actually more likely to progress to the more advanced stages of the condition. Kind of flips the script a bit, right?
Okay, so what's actually causing these flare-ups? The science of the flush. Well, the truth is, there's no single, simple answer. Science points to this really complex mix of factors, some stuff happening inside our bodies, and some triggers from the world around us. So on the inside, it's kind of like a perfect storm. You've got an immune system that's a bit overactive, blood vessels that are super sensitive, and a skin barrier that's not quite doing its job. And get this, genetics play a massive role. A study with twins found that almost half the risk is just inherited.
But all those internal factors, they're often just sitting there until something from the outside sets them off. We're talking about external triggers. And listen, this part is so important because figuring out what your personal triggers are, well, that's the absolute key to managing flare-ups.
All right, let's talk about diagnosis. How do you go from symptoms to certainty? Because getting that official diagnosis, man, it can bring so much clarity and give you a real path forward.
Well, the good news is, for most people, getting a diagnosis is actually pretty straightforward. A doctor can often identify it just by, looking at your skin and talking about your history. No fancy or complex tests needed, they just need to know what signs to look for.
And to make it official, they follow this really clear two-step process. They're looking for one of two primary signs, they call them diagnostic signs, or if those aren't there, they'll look for a combo of two or more major signs. And here's what they're looking for. The big ones, the diagnostic signs, are either that fixed redness right in the center of your face or skin thickening. You might have heard of rhinothema, which is when it happens on the nose. Now, if those aren't present, they'll look for at least two of the major signs. Things like bumps or pustules, flushing, those little visible blood vessels, and even eye symptoms.
Another huge part of diagnosis is ruling out other things that can look a lot like rosacea. For example, acne has blackheads and whiteheads, what doctors call comedones, but rosacea doesn't. Or something like lupus. That has a whole different set of systemic symptoms and markers in your blood.
Okay, this brings us to what I think is the most empowering part of all of this, a guide to management. We're talking about what you can actually do to take control of rosacea. All right, if you take away just one thing from this whole explainer, let it be this. The single most important principle is identifying and avoiding your personal triggers. It's different for everyone, and that's the whole game right there. Okay, so beyond avoiding triggers, there's a foundation of care that's essential for pretty much everyone with rosacea. We're talking daily, broad-spectrum sunscreen, think zinc or titanium dioxide, washing with super gentle, soap-free cleansers, and moisturizing to keep that skin barrier happy.
Now, sometimes lifestyle changes aren't quite enough, and that's where medical treatments come in. They're tailored to your specific symptoms, what doctors call your phenotype, which is really just a fancy way of saying how rosacea shows up for you. So for persistent redness, that might mean topical creams or even laser. For bumps and pustules, maybe oral antibiotics. And for more significant skin thickening, things like isotretinoin or even surgery could be on the table.
So as we wrap up, it's really important to frame this correctly. Living with rosacea, it isn't a one-time fix. It's really a continuous journey of discovery. The reality is, rosacea is a lifelong condition that can't be cured. But, and this is a big but, its symptoms can be really effectively controlled and minimized. The whole goal is to manage the symptoms, keep those flare-ups at bay, and give yourself a real sense of control over your skin's health.
And that's why we end on this question. What will your trigger diary reveal? Because honestly, keeping a simple diary of your symptoms and what you did each day, what you ate, the weather, your stress levels, that can be the most powerful tool you have. It completely changes the game from guesswork to a true journey of self-discovery.